Welcome to Moisage Therapy. I'm Moy, and I'm thrilled to have you here. Today, we're tackling the tension in the levator scapula muscle, which is essential for elevating the shoulder blade and assisting in neck movements. This muscle originates from the transverse process of the first four cervical vertebrae, C1 through C4, and inserts into the superior part of the medial border of the scapula. We'll dive into effective techniques to treat and release this muscle. So let's get started with our first technique, the active pin and stretch. Locate the superior angle of the scap and apply medium pressure with your thumbs or whichever tool you find most effective. Instruct your patient to look straight down, bringing their chin to the sternum. Assessing the movement pattern without pressure first is crucial for measuring improvements in the range of motion. Often, you can confirm tightness in the levator scapula when the patient's shoulders or scapula follows as they move their head. There are three movement patterns to consider. Having covered the first, now we move on to the second one. Pin the insertion as before. Then instruct your patients to laterally tilt their head as far as they can, ensuring the chin and nose remain pointing forward. This can be tender for many, so adjust the pressure accordingly. Start with about 30% pressure and increase gradually. The final movement consists of two parts. Have the patient turn their head away from you, then bring their chin towards their collarbone. For some patients, you can explore the anterior of the trapezius to feel the superior angle of the scapula. This requires you to navigate under the trap. Apply pressure with a scooping motion to engage the levator scapula. And naturally, you'll engage some of the fibers of the trap as well. If the skin under the garment becomes irritated, you can perform these techniques directly on the skin as well. Ideally, without lubricant, to maintain optimal contact and avoid damaging the patient's clothing. For an added layer of intensity, try this variation. Have your patient sit at the edge of the table and reach down and hold the bottom of it. This secures the scapula in place. Have them slightly lean away from the hand, which applies depression to the scapula. The range of motion of the head will be greatly reduced and intensified. Lastly, ensure the table is as low as possible so the patient's feet are flat and stable on the ground. This next technique is uncommon but very productive. We are targeting detachments of the origin of the levator scapula. Begin by reaching under the neck and curling the fingertips. Applying pressure with the index and middle finger. Use your second hand to gently apply opposing pressure on the forehead. The left hand should be pulling while the right hand is pushing. Move the head in an S-shaped pattern, back and forth, finding a nice, calm, easy rhythm. Once you feel like the neck is nicely primed, let's move on to the full version. Apply lateral traction with a slight upward pull. Use the other hand to guide the head to the right while maintaining contact the entire time. Hold the tension for a few seconds at the end of the rotation. Guide the head back slowly using both hands without pressure. It's crucial to communicate with your patient throughout the process. Make sure they're comfortable and inform you if they're experiencing any discomfort or pain. This beautifully translates to our next technique. Apply slight lateral traction with an upward pull. With your other hand, press the scapula down and turn the head opposite to the shoulder, stretching it if you will. Driving the patient's chin towards their collarbone by bending your wrist slightly. I personally like to reset every stroke by completely letting go, but you can finesse it however you please. Remember to maintain a smooth, controlled movements to avoid any sudden discomfort for your patient. A useful tip is to monitor your patient's breathing. Encourage them to take a deep, slow breaths, which can help them relax and reduce muscle tension. In through the nose, out through the mouth. And you know what? I feel like we're far enough into the video where I can ask. Would you consider subscribing? But only do so if you feel like I've earned your subscription. If not, no worries, I'll try again in the next video. But do me a favor and give that like button a little to Potman for me. Start by having your patient hover their hand a few inches off the table. Have them reach, dropping their shoulder into depression. Instead of reaching under the neck, cradle the head with both hands equally. Apply slight upward traction and turn the head opposite to the shoulder. Run this sequence a few reps so your patient doesn't have to hold their arm up for too long. Be aware of the angle and direction of the pressure. Make sure applying it in a way that follows a natural movement of the muscle and head. Move with caution and care. Remember, as a therapist, you don't have to apply the same treatment on both sides. Your patient often has asymmetries in their body that requires a little extra attention. Your goal is to create symmetry and balance in their body, so move with attentiveness and care. Let's explore one of my favorite techniques. Start by externally rotating the shoulder, which slightly depresses the scapula and shortens the trap muscle, allowing you to get under the trap belly and apply pressure into the insertion of the levator. Once you feel a solid anchor with a thumb at the superior angle of the scapula, instruct your patient to turn their head slowly at about a 3-second pace. I like to reset each stroke with a slight internal rotation of the arm. As a young therapist, I used to stress about time management constantly. I felt compelled to use every technique in my toolbox every single session, which sometimes made the massage feel rushed and inconsistent. Remember, it's important to be patient in selecting the best techniques for the patient. Ask for feedback and check in with them before you begin to gauge the success of the previous session. For those of you who made it until the end, I like to save the best for last. Thanks for sticking around, y'all. To perform this technique, grab the arm from the inside, resting the patient's forearm across your own. Pull the arm down and away, you guessed it, to depress the scapula. Start with a gentle circular pattern with your fingertips and incorporate a little cross fiber action for some variety. Once you feel like you've addressed the area sufficiently, transition to the thumb. Apply pressure just above the acromion. Continue to draw the arm away from the stroke as your thumb runs the length of the neck over the origins of the levator scapula. Apply pressure until you reach the base of the temporal bone, applying pressure with a pad, slightly flexing the patient's head. This technique is probably the most requested one from my patients because of its effectiveness. Thank you all for sticking around. I appreciate each and every one of you. If you enjoyed this content, feel free to subscribe for more like it. Sending much peace your way, and remember, always be kind and compassionate. Until next time, peace out.